You might rightly think that your OBGYN provides abortions, but in reality, only 24% of them do. That's despite 72% of OBGYNs saying they've had patients seeking an abortion. So why is that? Why do the majority of doctors specializing in reproductive health care not provide a service that's so in demand? There's a couple of reasons. There's rules their employers might put on their practice that make it either impractical or impossible to provide abortions. Medical residents might not be trained to perform abortions in med school. Only about half of medical programs have abortion care in their curriculum. There's also religious and moral beliefs of the providers. But frankly, if you don't plan to provide full-spectrum pregnancy care, you shouldn't become an OBGYN. Providing abortion care is also historically dangerous. Abortion providers have been murdered and are often harassed both at home and outside of work. So why do freestanding abortion clinics exist? Well, after the 1973 Roe v. Wade decision, most doctors were men, and many were ambivalent at best about women directing their own medical treatment. And later came medically unnecessary state restrictions that dictated things like the size of the room where abortions are performed or the width of hallways. Many doctors' offices don't want to deal with all that. Plus, it's expensive. So now 95% of abortions in the US happen in clinics. But what about abortion pills, you might ask? Surely those are very easy to provide in an OBGYN's office. Well, it was only in December 2021 that the Biden administration said providers could mail abortion pills to patients permanently, and a bunch of restrictions still remain. More OBGYNs say they'd be willing to prescribe the pills if there was less red tape.